Chatting to us is Dr. Tasleem Ras, who was one of the presenters earlier this morning, and he spoke about burnout in the medical fraternity. Dr. Tasleem, Jazakallah khairan for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullahi wa barakatuh. Shukran for interviewing and attending. Lovely discussion we had this morning.
Yes, indeed. Take us through some of the key points that you highlighted.
So, one of the key things that I said is that the medical world is facing one of the most serious existential crises that it's ever faced before, and that's related to the mental health that our medical professionals are facing. Due to a number of reasons, my thesis is mostly around looking at the clash of ethical theories. The one being delivering a service to the masses of people, particularly in an unequal society like ours. And the second is the toll that takes on the individual health professional. And that leads to a constant type of traumatic environment in which this health professional has to operate, which then results in a huge impact on the negative impact on the mental health. We see the highest rates of suicide, mental health problems, substance abuse amongst health professionals and doctors in particular. And we see an alarming amount of young doctors who are leaving the profession, who are even leaving the African continent as part of the brain drain. So we're in a moment in time that the Western medical system that we operate in has never seen before, making this a very serious issue that we need to think about and confront collectively.
This is quite alarming what you are saying, and how is it that we are not picking up on this in the general public?
I think because there is a focus that the show must go on. So from managers, from politicians, from people within the health system, the show must go on in the sense that we can't turn patients away from our facilities. We need to be doing something. But that constant provision of services is taking a toll on the individuals who are working within those services. And that is an invisible toll, because those are people who are just individually deciding on a one-on-one basis, I'm leaving the profession or whatever the case may be.
What do you propose?
Allahu Akbar. We need to first define the problem. So before we start thinking about solutions, and it's not solution coming from one person. This is us, and I'm speaking at the IMA conference because I think as an Islamic medical community, we need to start looking at what is an appropriate Islamic response that will start building a compassionate, supportive space for young professionals to be developing their professional identity in. So there's a lot of work. That's my response. There's no immediate solution on the table, but there's a lot of work that we have as a collective.
Jazakallah khairan.
Jazakallah to you.